Welcome to The Explainer. Today, we're diving into an issue that's, well, often unseen, a physical problem that can cause some really frustrating symptoms, the kind people are often a little hesitant to even talk about. We're going to explore what it is, exactly why it happens, and how doctors can finally make it visible. So, let's just get right to it. Do any of these sound familiar? Straining, spraying, just a weak stream in general? These are more than just little annoyances. They are often really clear signs that there's a physical blockage somewhere. In this explainer, we're going to connect these exact symptoms to a specific medical diagnosis. Okay, first up, let's talk about the problem with the flow itself. We're going to get a much better handle on these symptoms and figure out what our bodies are actually trying to tell us. And look, what you'll notice is how specific these symptoms are. This isn't just some vague problem, right? It's a weak or spraying stream, that feeling of hesitancy, like you have to strain, or that you're just not completely done. Sometimes it can even lead to recurring infections. These are all classic textbook signs of a physical obstruction. Honestly, this is the perfect way to picture what's going on. Just think about a garden hose, water flowing freely. Now imagine you put a kink in it. What happens? The pressure builds up, the stream gets weak, it sprays all over the place. That is exactly what's happening inside the body. It's a really simple but powerful way to visualize this kind of blockage. And here's the really crucial part. These issues typically don't just go away on their own. The source material really emphasizes that they are progressive and persistent. That means they tend to get worse over time. So we're not talking about a temporary glitch. This is a sign of a real structural problem that needs attention. All right, section 2, let's get into the anatomy of this obstruction. We've talked about the symptoms, the what. Now let's explore the why and actually put a name to this condition. So the medical term for this is a urethral stricture, and the definition here is absolutely key. It's a fixed anatomic narrowing. This means it's not a muscle spasm or some temporary swelling. No, it's a real structural change caused by scar tissue, which is exactly why it doesn't just go away. So how does the scar tissue even form in the first place? Well, it's basically a 4-step process. It all starts with some kind of injury to the lining of the urethra. Then the body does what it always does. It responds with inflammation. That's its natural healing signal. As it tries to repair that injury, the body creates scar tissue. There's a fancy name for it, spongiofibrosis. And then over time, that scar tissue tightens up and contracts. And that's what causes the physical narrowing of the channel. So where does that initial injury come from? Well, it can be a few different things. Iatrogenic is a medical term that just means it happened because of a medical procedure, like from a catheter. It can also happen because of inflammation from an infection or from a direct trauma, like a bad fall onto a bicycle frame. And sometimes the cause is what doctors call idiopathic, which is really just a way of saying we don't actually know. Okay, on to our third section, the path to diagnosis. We know the what and the why. So now let's look at how doctors take this completely invisible problem and make it visible. You see, the whole goal of diagnosis is just to get a crystal clear picture of the problem. You can't fix that kink in the garden hose if you don't know exactly where it is, how long it is, or how tight the kink is, right? This is where medical imaging becomes absolutely essential. And this is the main tool for the job, the retrograde urethrogram, or RUG for short. Now, retrograde just means the test works against the normal direction of flow. It's considered the gold standard. It's an imaging test that uses a special dye to basically light up the urethra on an X-ray, and that clearly reveals the location of any blockage. What's so amazing about the RUG is just how much detail it gives. It's not just a yes or no on whether there's a stricture. It gives the urologist a complete blueprint of the problem. It defines the precise location, the exact length, and the severity of the narrowing. And all of that information is absolutely critical for planning the right kind of treatment. And finally, our fourth section, clearing the path forward. Let's tackle a really common point of confusion, and then we'll wrap up with the key takeaways from all of this. This is such an important question because, a lot of the symptoms we've been talking about can overlap with another really common condition called benign prostatic hyperplasia, or BPH. But, and this is a big but, the cause and the treatment are completely different. This table just lays out the differences so clearly. A stricture is a structural problem, right? It's from scarring. BPH, on the other hand, is a functional obstruction caused by an enlarged gland that's pressing on the urethra. But here's the kicker. Strictures can affect younger men, while BPH is almost always found in older men. And that age difference is huge because it really challenges that old assumption that these kinds of urinary problems are only an older man's issue. So, no matter what specific treatment is chosen, the end goal is always the same. And it's actually beautifully simple. Open the channel back up. The whole objective is to restore urethral patency, which is just the medical way of saying make the tube open again, and relieve that blockage. So if you remember anything from our little explainer today, let it be these 4 things. 1, a stricture is a fixed physical blockage from a scar. 2, the process that causes it is called spongiofibrosis. 3, the URG is the definitive test to diagnose it. And 4, because these things are progressive, ignoring them can lead to much more serious issues down the line, things like damage to the bladder or even the kidneys. And all of that brings us to one final crucial question. Since we know these symptoms are progressive, it really shifts our focus, doesn't it? It moves us away from just passively accepting a problem and toward proactively looking for answers. So what does being truly proactive about your health look like? That's something we're thinking about.